I would like to give you approach for headache cases, how we should approach for headache cases. Important thing is, first we have to classify whether it is acute headache or it is chronic headache or it is intermittent headache. So acute headache will be presenting like within few hours time or within 1 day time. So this is acute headache. Then we have another category of headache that is known as chronic headache. Chronic headache means it is persisting headache. And the third category is intermittent headache. It means the headache is some days headache is there and sometimes the headache is not there. So it is coming and going, and in between the attacks, patient is symptom free, there is no headache. Acute headache, the causes of acute headache we should keep in our mind. The mnemonic is VIP rate. We'll write in the chat VIP. Rate, RAT. V for vascular. Vascular causes like arterial causes, venous causes. Arterial causes like acute headache can come as a case of temporal arteritis or joint cell arteritis. We have done this case before. Acute headache, arterial related could be because of carotid artery dissection or vertebral artery dissection. These are the arterial causes. Another arterial cause is subarachnoid hemorrhage also. Then we have venous causes like venous sinus thrombosis. Sorry, subarachnoid hemorrhage will not come under the heading of arterial cause, but it is different entity. Arterial causes, I will repeat again, temporal arteritis, carotid artery dissection, vertebral artery dissection. Venous causes like venous sinus thrombosis. Then the other causes of acute headache like subarachnoid hemorrhage and pituitary apoplexy. This is V. What is I? I is for infection. Infectious causes of acute headache includes meningitis, encephalitis, brain abscess, malaria cases, HIV cases can also present with acute headache involving the brain. P for post lumbar puncture headache. So it is procedure related. And another P is pre-eclampsia, in which there will be history of pregnancy of more than 20 weeks. Patient will be having hypertension and proteinuria will be there in the urine. So this is P. Then we have R. R means referred pain. Referred pain, referred headache coming from nearby structures, like from the eyes, from the ear, from the nose, from the tooth, from the face, from the mouth. So the different causes, just keep in your mind. The referred pain can also present with acute headache like. Then we have A. A is for acute closed angle glaucoma. One time or two times in the recent past, this case also came in the cases, acute closed angle glaucoma. Then the T. T is for trauma. T for trauma, like extradural hematoma case, can also present with acute headache. So few words about the acute closed angle glaucoma, then I will move forward. Usually they are presenting with severe ocular pain on one side of the eye with redness, associated with headache, and the patient will be having decrement in the vision field, decrease in the vision, and patient will also complain that he can see different colors in front of his eye. So the halos will be there, color halos, in and around the light, and it will be associated with nausea and vomiting. So this is about the acute headaches. Then the chronic headache, The mnemonic is most, M-O-S-T. M for medication overuse headache. Medication overuse headache. We will do sometime this case. In this condition, the patient having the migraine or migraine persistent for a long period of time, and the patient is taking the medicine very frequently, and it is now turning from migraine headache to medication overuse headache. Another type of headache that is commonly turning into medication overuse headache is tension-induced headache. Person is having tension every day. He's going to the work, and stressful condition, stressful work is there, and then he's having the persistent or chronic headache, and he's taking a lot of medicine for this. Now it is turning to medication overuse headache. So in chronic headache, the mnemonic is most. M is for medication overuse headache. O for obstructive sleep apnea headache. In that condition, the person will be obese, snoring will be there, and the other features we will do the scenario. S is for space occupying lesions, like the tumors, as we discussed our case, pituitary tumors, all four possibilities: non-secreting pituitary adenoma, non-secreting pituitary adenoma can have the chronic headache, acromegaly patient can have chronic headache, prolactinoma patient can have chronic headache, Cushing disease patient can have chronic headache. Space occupying lesion. So other space occupying lesion could be other primary brain tumors, as we discussed, GMC, ganglioma, meningioma, craniopharyngioma. Then also include idiopathic intracranial hypertension also here, because in this condition also there is increased intracranial pressure. Then in the S, you can include subdural hematoma also. That will be also having the chronic headache, and the patient will be elderly with history of recurrent falls, and there may be history of alcohol intake. Remaining is T. T is tension headache. Tension headache also chronic headache. The scenario I already discussed. A stressful condition at home or at the workplace, and the patient is having almost daily headache. So these are the causes of chronic headache. Then we have the third category, that is known as intermittent headache. Other name for intermittent headache is primary headache. It is migraine. And the second one is cluster headache. Remember these two only. Migraine headache also and cluster headache also. They are coming and going. And in between the attack, patient is symptom free, could be symptom free, not having any headache. So whenever you are having the case of headache, first thing you have to categorize your patient, whether the patient is having acute headache or chronic headache or intermittent type of headache. Then you will proceed from there. Then we have to apply the Socrates completely. Site of the headache, onset, sudden or gradual, or how it is started, character of the headache, radiation means moving anywhere or no, associated symptoms, very important to ask about, temperature rise is there or no, or visual problem is there or no. Okay, then since T is for time, since it started, it is how it is behaving, it is increasing or decreasing or same. Okay, then E for exacerbating factors and relieving factors. Okay, so T S is for severity, how severe is the headache. So this is about the, for any pain, we have to apply the Socrates. So here also we will apply the Socrates first, and then we will go for red flag signs of the headache. Can you show the slide, Mr. Edmund? I told you one slide written spoon or snow. Okay. So the red flag signs for any headache, we should ask the patient is no. The mnemonic is no. S is for systemic symptoms that we have to ask. Fever, especially fever, fever with chills, myalgia, weight loss. These are there or no. N is for neurological sign and symptoms about the deficit to rule out the stroke or mass lesion or encephalitis. So neurological symptoms we have to especially find out whether the patient is having any focal neurological deficit is there or not. Then the O is for older age of onset after the 50 years of age. So we have to think certain type of headache like temporal arteritis, glaucoma, and mass lesion. Then another O is onset. If it is thunder scalp headache, it is red flag sign, and headache of sudden onset is also red flag sign. So it indicates the bleed inside the brain. Then the papilloedema. P is for papilloedema. The features of raised intracranial pressure. The patient will say that this headache is increasing with coughing and sneezing and bending forward. So it is indicating that this like patient is having features of papilloedema or raised intracranial pressure is there. Other than this, patient will be having projectile vomiting and headache can wake him up from the sleeping position. So the raised intracranial pressure headache, patient, you can ask the patient, did this headache wake you up from the sleep because of this headache? So if he or she says yes, so it is also indicating that the patient is having raised intracranial pressure. Positional, again, positional as we discussed, it is if it is increasing by bending forward, so it is indicating increased intracranial pressure. If it is precipitated by Valsalva maneuver, again indicating raised intracranial pressure. And yeah, so these are all about the red flag signs. I will share this one in the group of WhatsApp. So it is there. Try to follow this, please, to ask the question related to red flag signs of the headache. Okay, then what would be the causes? Oh yeah, now it is shared also here. Okay, now there are causes for headache with increased intracranial pressure. For this, I will give you, yeah, I'll give you the mnemonic, another one, BBC, GMC. B is for brain abscess, and B is for benign intracranial hypertension. The old name is benign intracranial hypertension, but the new name is idiopathic intracranial hypertension. Then another B is brain tumor trauma. Brain tumor trauma, intracranial hemorrhage. So these are the two B's. First B is brain abscess, benign intracranial hypertension. Second B is brain tumor, brain trauma. Trauma leading to intracranial hemorrhage. Okay, then the C is cavernous sinus thrombosis. Okay, Dr. Vikash, you can leave and that one you can listen the recording. Thank you, Dr. C for cavernous sinus thrombosis. Okay, then GMC. G is for Guillain-Barré syndrome or GBS. M for malignant hypertension. And C for cerebrovenous thrombosis. Cerebrovenous thrombosis. Cavernous sinus thrombosis is different and cerebrovenous thrombosis is different. So BBC and GMC. So these are the causes where you will see the intracranial pressure is high. BBC, GMC. And I told you what will be the features of increased intracranial hypertension. And primary brain tumor, I already told the mnemonic is GMC. Glioma or ganglioma also, ganglioma, paraganglioma, glioma, M for meningioma, C for craniopharyngioma. Other tumors also like oligodendroglioma and schwannoma. You can make like GNCOs, so it can include other tumors also. Okay. G for glioma or ganglioma and paraganglioma. O for M for meningioma, C for craniopharyngioma, O for optic nerve glioma also and oligodendroglioma, and S for schwannoma. So if you remember all these, you will be on a safer side and of exam you will like it. So this is all about the approach of the headache.